Moving ahead, we head to our last speaker for the day, Mr. Sumeet Singh, who comes from a wide technology knowledge and background and has a passion towards integrating technology when it comes to healthcare sector. So from him, I would like to understand how digital technology and mental health can bridge the gap in this demand and supply. There are rural areas in India, there are people with different languages. How can these people connect to professionals around the globe, not just the nation? How can this technology help us? Over to you, Sumeet.
Thank you, Shruti. And firstly, I'd like to thank my panelists for just simplifying it so brilliantly, these glaring issues that we as a nation and we as a world are facing in the mental health sector. In the world we live today and pandemic raging around all of us, we have started talking about how important emotional and mental well-being is, right? I'm sure all of us know someone who's isolated, who's lonely, worried about their health and anxious about their future. It's obvious that mental well-being and emotional health is central to our existence, and we need to do something about it. But as we have heard during the discussion, that during the pandemic, or even before that, the issues of mental health have grown both in terms of demand and supply. Right, as Rayman rightly highlighted, there are over 950 million people globally living with mental disorders, and 300, one third of them, 20 million, are in our country itself. To just give you a snapshot of the reality of what actually happens in rural India, and this is a fact in the program. We encountered a 20-year-old mother, right, with a mother of 5 weeks baby. She's already had two miscarriages, confined to a small house where she's not allowed to meet people due to traditional. She starts neglecting her baby, sleeps most of the time, unaware of the baby's cries. She cries frequently, wants to be alone, unaware of what she was going through. And the family started blaming her for not being a good mother. She was suffering from something which is called postpartum depression. And postpartum depression is the leading cause of maternal morbidity and mortality. And yet we are so unaware about it, yet there's stigma attached to it that we cannot talk about. Nearly 80% of Indians suffer from mental disorders, who are suffering from mental disorders, do not receive treatment for more than a year. And India accounts for one-fourth of the death by suicide globally. And the maximum number of suicide takes place in the age group of 15 to 29. What Shuchi was right now talking about is the young generation, how easily they have Christian language. In terms, these are the most productive years, and yet we are facing so many suicides. That is, despite these staggering facts, there's a huge treatment gap, and the gap between the haves and the have-nots has increased really wide. And my question is, why wouldn't it be? What Shivani said, what Dr. Shivani Kansal said, that for the 100,000 population, we have only 1.90 mental workers who, in times of pandemic, are overburdened, they get redeployed as they face the unprecedented demand. So the challenges addressing this gap, and Shuchi, what you asked, how can we face these challenges, warrants innovative approaches that operate in parallel with the traditional strategy. We cannot substitute the traditional strategy. It needs to be sort of complemented, right? This is where the application of emerging technologies holds promise in potentially understanding where the current different dimensions of global mental challenges are. What we discussed this throughout our discussion, lack of integrated interventions, reduced risk factors, the stigma associated with mental health, the shortage of specialists who are trained specialists, right? Limited access to mental health services in vulnerable groups, and those living in remote areas. I think one thing which Renu rightly pointed out about was the data. We do not have data in the public health scenario where we can actually collate and use big AI to bring about a change in the scale and complexity of the challenge that we are facing. So one thing that has come up and due to COVID is the virtual care and other digital tools have become more important than ever in supporting existing care and providing scale and increasing capacity. Clinician-based virtual care replaces traditional in-person office visits with synchronous video audio visits or with asynchronous text messaging. These provide alternatives to traditional systematic therapy and allows for a better match of supply and demand across day and geography. So a kid in the remote area of rural area, right, at his or her unearthly hour, let's say at 2 o'clock at night, is able to connect with a psychologist sitting in Chicago or Atlanta or Australia somewhere and getting the help. This is how technology is bridging that. Apart from that, in terms of non-clinician based digital mental health services such as chatbots, video and written content, gamified user experiences, and digital cognitive behavior therapy programs are also act as good adjunct to clinical based virtual care, allowing 24/7 access for those with less intensive. I am highlighting the fact here that it is less intensive need, right? So increasingly innovative mental health organizations are combining digital tools and virtual care to create a robust ecosystem for end-to-end patient care, including steering patients for in-person care when they need. So it's not always, like we've heard from our various panelists, that it's not always a person requires to see a therapist or a psychologist or psychiatrist. Technology helps in triaging that. Technology helps increase access to an on-demand support program, which guides users in addressing low equity mental health care needs, such as mild depression or anxiety, even through secure texting with trained coaches, or through AI-based tools. So while traditional 15-minute sessions are available right now, much care is delivered in small bites, which also allows therapists to care for more patients and have more flexible schedules. These solutions have also the potential to lower practitioners' overhead, right? Whether it's the infrastructure or other things, and they broadly increase the access to potentially lower the cost to patients. So that's why Shashi, I believe that technology plays a very important role. That it provides the end user access to affordable care in a system which can be confusing to navigate, as Dr. Shivani Bansal pointed out, right? So when we're talking about pandemic and the associated lockdown, they have left more patients in need, but with little choice to move away from in-person care. We'd be happy if we can provide in-person care to everyone. However, we do not have that demand supply or capacity right now. I would also like to pinpoint that virtual and digital care isn't for everyone and sometimes is inappropriate in some cases. For example, the emergency situations I was talking about. However, virtual and digital care can improve affordability, provide critical additional access for those in need. In a report, I think by Accenture in 2021, 51% of patients said they would choose to receive mental health appointments virtually. Those in Gen Z were more than 4 times more likely than baby boomers to prefer virtual care to in-person care. In addition, some communities which historically face stigma and discrimination may prefer virtual or digital care as it ensures anonymity. So the pandemic has put a spotlight on the value of virtual and digital mental health care. And by doing so, it might, in my opinion, have thrown a lifeline to our mental health system, which is already overstretched and overstressed. If we can harness the learnings from pandemics and to drive increase the appropriate use of digital tools and the appropriate digital tools, right? We can significantly improve the long-standing problems of inadequate access to mental health. Critically, digital tools will allow us effectively to meet the mental health needs of people of our country more than ever before. So this is how, Shuchi, we are tying the entire ecosystem with virtual care, with digital therapies, and also one of our panelists said that there are courses available right now. Education is being online. So accessing trainings, accessing training programs, accessing courses, accessing these virtual tools helps in bridging the gap that we're currently facing